Hi and welcome to our channel. Please don't forget to like, subscribe, and leave your comments down below so we can further engage, as citizens remain divided with many criticizing Operation Dudula. Media houses brought healthcare professionals for more answers on what they face on a daily, and what they said was shocking. Let me play the clip and then be back with the rest of my commentary.
Allied Workers Union is concerned about the increasing intimidation of foreign nationals at public health facilities. Over the past weeks, Operation Dudula members have been accused of blocking foreign nationals from accessing health care. Joining us now, Rich Sigcina, IHAU's president, as well as Karabo Mpendulo, IHAU member, and also a health worker. Good to have you both, and thank you very much for your time and coming on. Let me begin with you, Rich. I mean, the incident, others calling it deeply troubling, others calling it a necessity, depending on which side of this particular debate you are sitting. As health workers, how are you finding this debate? Is it helpful for you?
Thank you very much for having us here, Dudula. It's a catch-22 situation, to put it straight. We find ourselves as healthcare workers in particular put in a precarious position. We are facing an ethical dilemma where we are saying, obviously, in everything we do, it must flow from the Constitution, it must flow from the Nursing Act, it must flow from the oath that we took as healthcare professionals. It's either we are a nurse or we are a doctor, it doesn't matter whether we are a physiotherapist. Now, whatever has been happening, those so-called people, foreign nationals, whether they are documented or not documented, when they are in our midst as healthcare professionals, we need to provide services. Yeah. We need to provide medical treatment. It's true, Dudula, that the system is overworked, is overwhelmed, the system. We are overworked, there's gross shortage of staff and there's gross shortage of material resources. Now you are facing a situation where we are doing everything is even from our own pocket. At some point, I was saying we are buying refuse bags. We are buying food at some point when there's no food. We are doing a lot of things. And as healthcare professionals, we don't discriminate when we are doing these things. But it actually hurts us when someone is going to... Actually, I know someone whose mother died in an emergency department in casualty, simply because our facilities or our wards were full. And when you go into those particular wards, there are foreign nationals, documented or not documented. And obviously, South Africans are sitting there, sleeping on those stretchers in an emergency department. Then when you are nursing them, obviously you are caught in between the hard place and the rock to say, what then do you do? Do you split yourself into saying, this rich is going to nurse South Africans and this other one is going to nurse foreign nationals? No, we don't do that as healthcare professionals in particular.
Look at us, Karabo, we're being so impolite, myself and Rich. Happy Women's Day.
Thank you so much.
That's where we should have begun.
And happy Women's Day to the viewers who are watching today.
Operation Dudula would say, Karabo should appreciate what we're doing. We're actually giving her an opportunity to breathe. She's overwhelmed already because of just the pileup of work that she needs to do and, of course, the limited resources. Do you appreciate what they are doing?
I don't think I should use the word appreciate, but I would agree that it has alleviated the work that the healthcare workers have had to do, considering since the operations have started. We have seen a limited number of foreign nationals, documented, undocumented, coming into our facilities. It has at least taken off the burden from some healthcare workers, of which it's been a cry for most of the healthcare workers that we are overworked and overburdened, and merely because the government is not acting correctly or rightly by ensuring that these foreign nationals that are here, there's border control, they have documents, and them getting a service, it's within the transcripts of the Constitution. So the burden of healthcare workers currently in facilities where there is this Operation Dudula, there's been a less burden for these healthcare workers, and truly most of them do say that with this thing that has been happening, we have seen more efficient services, even South Africans themselves.
Yeah. Now, Rich, you're saying in your statement, I mean, citing a number of things, if they were done to you, you're saying we would not be having this problem. One, if we are investing in the infrastructure, if we are investing in human resource, we wouldn't really be feeling the burden as much as we are feeling it. Two, if we take care of the borders, we wouldn't be feeling the burden as much as we are feeling it. If we monitor those who are in the healthcare system, foreign, local, documented, undocumented, if we knew that and did the proper audit, we wouldn't be having this kind of a challenge. Where do you think we went wrong?
We have, we have poverty of leadership in South Africa. Those in positions of authority, they are just there, occupying a space. I usually say the system has actually absorbed them into substandard way of doing things and mediocrity. It has reduced them to nothing and rendered their existence useless. That is why we have a situation where we have the Minister of Health who comes on these particular platforms and whine like us, ordinary members. We will have a premier of the province here in Gauteng, Panyaza Lisufi, who will also take such a stand and whine like everyone and say we need to do something, instead of saying let's do something about those porous borders. Let's do something about the dilapidated healthcare facilities. Let's do something about the gross shortage of staff and gross shortage of material resources. When you look into it, when you zoom into this blockage of foreign nationals, it's really not necessary. Healthcare system is used because we are there, we have been making noise that we are struggling. That is why some of our colleagues they come across as rude. We are frustrated. You stretch yourself there. Where did we lose it? We lost it because those in positions of authority, politicians in particular, they are not the beneficiaries of the public healthcare system. If the public healthcare system was running like a well-oiled machine, trust me, it was going to be another department that was going to be used as a decoy to highlight the increasing influx of foreign nationals in South Africa. Yeah. But now healthcare system is perfect because some of these so-called foreign nationals, they have, I've experienced them. Some of them have more than 5 files. They open files from different clinics. Yeah. They are collecting the chronic medication. Even if we are consulting this particular person, this person will actually come with a child who they are claiming the child is sick. But upon your assessment as a healthcare professional, you realize this child is not sick, and they are demanding. They will be demanding cough mixture. They will be demanding Panadol, on all these other things. They collect chronic medication. Obviously, they are taking. Some of them are telling us straight because I am a healthcare professional working in a pediatric department. Sure. I admit them more now and again. They actually say everything South Africa is having, we take this medication to sell it back into our countries or give it to our relatives.
So what do you say in that instance? I mean, as you put it, it's an ethical dilemma from what you're supposed to do as a professional, but also what you're supposed to do as a citizen of the country.
It's unfortunate, at some point I actually said, unfortunately, Tina, or let me put it fortunately, not unfortunately. Fortunately, when we buy bread, our healthcare system is it's in tatters. The MECs, the SODs, some CEOs are presiding over a mess. They are presiding over a chaos. What then do we do? It's us, as nurses in particular, who are holding the system tight. It's us who are buying cartridges from our own pockets. Yeah. It's us who are buying the so-called refuse bags. We buy food, we buy bread so that they can eat if sometimes we have challenges of food for whatever reason. And when we are doing that, we don't say, no, we are not going to do these photocopies for foreign nationals. With this bread, when we buy it, we include. At some point, I actually counted. We were frustrated in my own unit. Sure. We had 88 patients. We were only 3 on duty. And I decided to let me count it because in this unit, there are foreign nationals. Only to find out, obviously, we had 19 foreign nationals, 19 South Africans. And all those foreign nationals were undocumented. You know what? Everything we do equally. Sure. As healthcare professionals, we said that we are a doctor or a nurse, we do not discriminate.
But what Rich is saying there, do you feel you need the policy to be clearer, to give you more power, or will it make no difference to you as a healthcare professional? If the policy were to come out today and say, well, as from this month, we don't provide such services to undocumented foreign nationals?
Unfortunately, it is not the position of healthcare professionals to do that. And if the department were to decide to do that, it will go back to looking at what the Constitution says, because everything will have to downright come from what the Constitution says. And because there's that particular Section 27 that says everyone has a right to health, it will mean that those who are in the Department of Home Affairs, people who do the Constitution, people in Parliament will have to resolve on these issues, foreign nationals, because we've been failed by the government and the state itself in terms of control of these foreign nationals that we have in our country. So unfortunately, it is not up to us. We do not have the jurisdiction to do that. Ours is to save us this patients that we see in our facilities. So if that policy would have to come, and if it's law-abiding, it's according to law, and the Parliament has agreed on it, I don't think would have a difficulty in ensuring that we stick to what the policy says. But currently, we don't have any, and therefore we don't have a leg to stand on, but rather the oath that we've taken that we are here to save lives and to save patients.
Is it a unique situation for healthcare professionals in South Africa, right, that have to deal with this ethical dilemma? Or do you find that there are instances elsewhere in the world where you can look at least and glean some best practice?
It is actually a unique situation. When you look at it, everything is flowing from the Constitution. If you listen to Minister Mtswaledi, he was actually saying it's wrong for people to block foreign nationals because the Constitution allows them to do that. No one has the Constitution that we have in South Africa. There's no country in the world that has a Constitution that allows everyone, that actually says everyone has a right, and we are actually using that. That is why the so-called foreign nationals, even though they are here illegally, they still can take the state heads on, they still can sue the states, they can still litigate in line with the Constitution. Obviously because of misinterpretation of the Constitution, because when it says everyone, who is everyone? Are we meaning everyone the world? Or we mean everyone, South Africans? When you look into page 9 of the Constitution, it is talking to the size of the country. It is also talking to the population and the official language.
Interpretation to others say, well, everyone within the borders. Others would say everyone within the borders who are documented, suppose, who are known by the system. You know, and hence I'm saying, should we not be seeking clarity on really what does the everyone mean, and are there limitations, and what are the permutations to the everyone question?
Exactly. That is where we need to start. I agree in as far as that is concerned. We need to fix that everyone. We need to fix the issue of when even subsection 3 of the same section 27, it says no one may be refused medical treatment. It's clear as far as that is concerned. So obviously, with us as healthcare professionals, we flow from the Constitution. That is why when you see Dudula, they usually never use the Constitution. They flow from the Immigration Act, because the Constitution in particular is silent in as far as how then do we treat foreign nationals, whether documented or not documented. The Constitution must be clear. The Constitution must be amended, and there must be pronunciation in the Constitution that says, in as far as healthcare sector is concerned, in as far as giving healthcare medical treatment is concerned to foreign nationals, documented or not documented, that must be well articulated in the Constitution. Currently, the Constitution is silent. That is why we are using that Section 27 that says everyone.
Yeah, let's leave it there. Much appreciated. Thank you.
After hearing what our healthcare professionals had to say, you can't help but see how our country deserves better than the current leaders we have. Please don't forget to share your thoughts on what you think about what our healthcare worker shared. Thanks for watching. Please don't forget to like, share, and subscribe to our channel, and leave your comments down below.